Introducing Celox Gauze, designed for the control of moderate to severe bleeding injuries. Uncontrolled hemorrhage remains the main cause of death for civilian adults under the age of 40. Stopping a moderate to severe bleed can challenge even experienced paramedics and emergency responders. Help is often too far away, or the casualty bleeds to death before help arrives. In some situations, severe bleeding can lead to exsanguination in under 5 minutes. Fast and effective treatment is needed to save lives. Celox is proven to stop severe bleeding fast and is trusted by militaries, emergency services, and health professionals the world over. Celox Gauze has been incorporated into the Tactical Combat Casualty Care Guidelines as a hemostat choice for multiple military forces and first aid responder units around the world. Celox Gauze is a highly effective dressing and is designed to stop bleeding from arterial injuries, road traffic accidents, and other moderate to severe bleeding injuries. Celox has become one of the main products currently used by the UK Armed Forces. Some hemostatic agents work by accelerating the body's own clotting factors, but these can become compromised in severely bleeding casualties. Celox is different. It works independent of the blood's intrinsic clotting mechanism. Celox works physically at the source of bleeding. Celox Gauze absorbs blood fluid, swells and forms a gel-like plug that covers the wound and stops the bleeding. Celox Gauze is presented in a lightweight, low-cube foil pack that has a 5-year shelf life and no allergies reported to date. The following training video is a guide to using Celox Gauze to pack a wound according to the product indications and packaging instructions. When responding to a casualty, it's important to identify massive external hemorrhage as soon as possible. Fully expose the wound, identify the point of bleeding, and apply direct pressure to stem the flow and gain control of bleeding. If blood has pooled in the wound, remove the excess using plain gauze, swabs, or whatever material is available. Celox Gauze is indicated for moderate to severe bleeding. Familiarize yourself with the product's packaging. It has 4 tear notches, 1 at each corner. While maintaining pressure on the wound, open the pack and remove Celox Gauze from the packaging. Take one end of the gauze and tightly pack the unfolding Celox Gauze from the packaging directly onto the source of bleeding, feeding in the Celox Gauze until the wound is filled beyond the skin level. For larger wounds that are not filled up by a single Celox Gauze, use an additional Celox Gauze or another plain gauze to fill above the skin level. As soon as the wound is packed, apply firm, constant pressure for 3 minutes. Visually check for bleeding around the dressing while still maintaining pressure. If bleeding has not stopped, reapply pressure until bleeding stops. If necessary, cut or tear off excess Celox Gauze before securing the dressing in place. Wrap the wound using bandaging or a pressure dressing to secure and maintain pressure. Discard any remaining Celox Gauze. Maintain pressure at all times. Remember to bandage tightly to maintain direct pressure through to the hemostatic. Record that Celox has been used in the wound. Place the packaging inside the bandage for the next stage of care. Check periodically and reassess the wound for bleeding until reaching the next stage of care. Remember to follow these steps when applying Celox Gauze. Identify massive external hemorrhage. Gain control of the bleeding. Expose the wound. Identify the point of bleeding and apply direct pressure. Swab excess blood. Pack onto the source of bleeding. Apply firm pressure for 3 minutes or until bleeding stops. Secure with a dressing to maintain pressure and discard any remaining Celox Gauze. Tuck Celox packaging into bandage. Transfer the casualty to the next stage of care. Celox Gauze is presented in a lightweight, low-cube foil pack that has a 5-year shelf life and no allergies reported to date. It works with 3 minutes compression, stopping moderate to severe bleeding. The technology has been proven successful to stop hypothermic bleeding. Celox Gauze is a highly effective dressing for moderate to severe bleeding. made to save lives.